Lately, we've been seeing a lot of attacks across the country and here in Kansas against trans people's rights and their bodily autonomy. We've also been seeing a lot of disinformation about gender-affirming healthcare for trans young people. We're here to dispel the myths and set the record straight. Here's 5 facts about gender-affirming healthcare for trans young people. Every major medical association agrees gender-affirming care for trans young people is medically necessary, safe, effective, and evidence-based. Number 2, trans young people don't make healthcare decisions on their own. Psychologists, psychiatrists, family physicians, and specialists all work together with trans young people and their families to determine their best course of treatment. And for minors, their parents or guardians must consent to the treatment. Number 3, gender-affirming healthcare for trans people differs vastly depending on their age. Prepubescent trans kids are not receiving permanent or irreversible care. Number 4, research shows that 98% of young people that start gender-affirming care as adolescents continue that care as adults. And among the small number of people that do stop receiving gender-affirming care, the most common reason for doing so is not because of regret, but because of inability to afford the care or fear of violence for living publicly as a trans person. Number 5, there's no evidence that families are being pushed into this care. Rather, they're able to determine what's best for their kids after proper evaluation and informed consent. And these healthcare bans would take away families' only evidence-based options for care. So ignore the myths, remember the facts, and stand up for trans people.